Well, hello there. My name is Linda. I am trying to test for the NCLEX in the United States of America. That is the nursing board exam. And it does not matter where you live, but you can test for the boards in any other states. There are some states that have, I guess, these agreements where if you test and pass the boards in one state, you can hold the license in the other states also. But you can check more of that on the website. Just type in, nursing boards. Okay, so the NCLEX is okay. So you know what, just to make this a little bit more interesting for myself, I'm going to be talking in a very strange, I don't know what kind of an accent it is. But so the NCLEX has 4 different parts, and they're all concentrated on the client needs. And we in the United States is trying to figure out how to be focused on the clients, aka the patients. I don't know why we don't really refer to them as a patient anymore, but anyways. So client need area number 1 is the psychosocial. Sorry, my apologies. This is from the Nursing Council's exam bulletin. So number 1 is actually safe and effective care. Because if you don't have safe and effective care, why would you even go to the hospital? And it is, let's see, has 2 subcategories. Has the management of care and the safety and infection control. And both is should have about 1/10 of the exam to be exact. The management of care counts for about 16 to 22%, so it could be about a quarter. Sorry, I have all these little things with my hands because I'm more of a visual kinetic learner. I learn better when I'm up and moving around, so you might see me moving around. But I do love my charts for my visual, so I might be drawing things. Just give you a little preview of the upcoming videos that I'll be making. So, management of care 16 to 22%, safety and infection control is about 8 to 14%. And under these areas, we have management of care, we have advanced directives, advocacy for your patients, care management, client rights, collaboration with the interdisciplinary team, concepts of the management, confidentiality, information security, consultation, continuity of care, delegation, establishing priorities, ethical practice, information technology, informed consent, legal right and responsibility, performance improvement or quality improvement as they're called, referrals, and supervision. We'll go into details later on these topics. Under safety and infection control, we have accident and injury prevention, emergency response plan, ergonomic principles, air prevention, handling hazardous infectious materials, home safety, reporting of incident or irregular occurrence or variance, and the safe use of equipment, security plan, standard precaution, transmission precaution, surgical sepsis, use of restraints and safety devices. So there you go. That is client need number 1, safe and effective care environment. Moving on to client need number 2, health and promotion maintenance. This accounts for about 6 to 12%, has no subcategories, would cover the aging process, intra, postpartum, and newborn care, development stages and transition, health and wellness, health promotion, disease prevention, health screenings, high-risk behaviors, lifestyle choices, principles of teaching and learning, self-care, techniques of physical assessment. Under client need number 3, which is psychosocial integrity, accounts for, again, 6 to 12%, same as client need number 2. Health and promotion and maintenance. Alright. So client need number 3, psychosocial integrity, covers abuse and neglect, behavioral intervention, chemical and other dependencies, coping mechanisms, cultural diversity in the life care, family dynamics, grief and loss, mental health concepts, religious and spiritual influences on health, sensory perceptual alterations, stress management, support systems, therapeutic communications, therapeutic environment. This is a small area of the NCLEX. So we come to the fourth client need area, which is very major. This is the physiological integrity. Under it, we have 4 different subcategories. Number 1 is basic care and comfort, accounting for 6 to 12% of the exam. We will need to know about assistive devices, elimination, mobility and mobility, non-pharmacological comfort interventions, personal hygiene, rest and sleep. Another subcategory onto this is pharmacological parental therapies, accounting for 13 to 19%. This is probably one of the biggest areas and one of my weaker points, so we'll be having lots of trying to make them interesting videos, which includes adverse effects, contraindications, side effects, interactions, blood and blood products, central venous access devices, dosage calculations, expected actions and outcomes, medication administration, parental intravenous therapies, pharmacological pain management, total parental nutrition. Another subcategory is the reduction of risk potential, accounting for 10 to 16%, another big area here, including changes, abnormalities in vital signs, diagnostic tests, lab values, potential for alterations in body systems, potential for complication of diagnostics, tests, treatments, and procedures, potential for complications from surgical procedures and health alterations, and system-specific assessments, therapeutic procedures. And of course, the last subcategory is physiological adaptation, accounting for 11 to 17%, another large area. A little bit after the pharmacological and parenteral therapies and the reduction risk potential. This area includes alterations in body systems, fluid and electrolyte imbalances, hemodynamics, illness management, medical emergencies, pathophysiology, unexpected response to therapies. So, those are the 4 client need areas, and each of these subcategories, if they have them, as you'll see, I should probably be concentrating on the biggest part, which is physiological integrity. So, we have our workout cut up for us. I am testing in about 2.5 months. There will probably be a video every day. Has to be one at least every day. As you can see, there's tons of topics. So, thank you for joining this journey with me. And do message. I intend to check this channel a little bit more. Clean my inbox, and I'll be looking forward to this great and wonderful journey. Alright?